Hello viewers and welcome to Health Loop. According to the U.S. Centers for Disease Control and Prevention, CDC, around 30 million of the U.S. population struggles with diabetes, including 23 million diagnosed and 7 million not diagnosed. The CDC also declares that 33.9% of the U.S. society has prediabetes. With that said, it's essential to identify the early signs of diabetes. The problem is that most early symptoms can be so mild that most people rarely note them off. The issue with this is that when a person gets blood sugar complications, it's usually cause long-term damage to their body. The only way to prevent this is to watch for the early indications that our body manifest to warn us we are now at higher risk of diabetes and other severe health complications. Now, keep watching to find out the most important signs that tell you your blood sugar levels are too high, along with symptoms to look out for if you think you may have diabetes. Before we begin this video, don't forget to subscribe to our channel for more daily tips like this and turn on notifications never to miss our new videos again. 10 signs your blood sugar is high and aches diabetes symptoms. 1. Frequent urination. When your blood sugar is high, your kidneys are the organs trying to expel this excess blood sugar, making you urinate more frequently. One of the earlier warning signs of diabetes is frequent urination. It's urgent enough to wake you up to go to the bathroom during sleep. 2. Increased thirst. While your kidneys are working harder and you're urinating more frequently, vital fluids will be pulled out from your tissues. So, this frequent urination and overall dehydration will make you feel constantly thirsty. 3. Fatigue. When your blood sugar is high, your body needs to work harder to eliminate this excess sugar. Not only does this process negatively affect your body, but it also worsens the way that it uses glucose for energy. So, excessively high blood sugar, or hyperglycemia, has a fatiguing impact on the body. Additionally, the dehydration that follows the more frequent urination is also a common cause of fatigue in people with diabetes. 4. Blurred vision. Constantly high blood sugar can cause damage to the small blood vessels of the eye, resulting in a swollen lens. You may have trouble focusing then, over time, leading to blurry vision. 5. Extreme hunger. When blood sugar levels remain abnormally high, the body can't convert and use the calorie you eat for energy. It's because glucose cannot enter the cells and cannot be used for energy. This energy lack causes an increase in hunger, leading that you may still feel cravings even after you eat. That's because your muscles and tissue aren't getting the energy they need from the food. 6. You're hungrier than usual but losing weight. Rapid and unexplained weight loss is common with diabetes because the body can't absorb glucose sugar properly. When your body cannot use glucose for energy, it breaks down its muscle and fat to produce the lacked energy. So, even if you eat more food, you're still going to lose weight. Unexplained weight loss is considered disturbing when it is at 5% of overall body weight. 7. Itchy, dry skin. When diabetes impairs blood circulation, our sweat glands will often become inefficient at their job, resulting in dehydrated, itchy, irritated, and flaky skin. This is why skin issues are often one of the first signs of a problem and the first indication of diabetes. 8. Dry mouth. Dry mouth is another of the early symptoms of type 2 diabetes. Actually, it's considered one of the most common and can affect those with type 1 diabetes as well. One of the potential causes for that is the lack of good body hydration due to the unquenchable thirst mentioned earlier. You may experience symptoms like a reduced amount of saliva, dry tongue, cracked lips, and if it's advanced, you may have difficulty swallowing, chewing, or even while talking. 9. Stomach problems. Over time, high blood sugar levels can affect your vagus nerve. One of its functions is to control how quickly your stomach empties. When the vagus nerve is damaged, your digestion slows down, and food stays in your stomach longer than it should. Food that leaves in the intestines too long can spoil and lead to the growth of bacteria. This condition is known as gastroparesis and usually can lead to bloating, abdominal pain, nausea, or vomiting. 10. Frequently headaches. Experiencing a headache may be an early sign of blood sugar that is too high. A headache itself isn't inevitably harmful, but it does become a concern when you're experiencing them frequently. It can appear when your blood sugar gets too high or when your blood sugar gets too low. This makes people with diabetes with bigger chances of a frequent headache than people without the condition. Now that you know about some signs that your blood sugar is probably too high, here are some more severe symptoms to look out for that you may have diabetes. 1. Slow healing cuts and wounds. same as damaged eye tissue causing blurred vision. Impaired blood vessels cause weakened blood circulation. Henceforth, it's much harder for blood to reach the affected zone, and minor cuts or wounds can take weeks or even months to heal. But what's worse, this slow healing makes unhealed wounds and cuts prone to infection, increasing the risk of amputation in the future. 2. Frequent or recurring infections. Experiencing frequent infections is another red flag for type 2 diabetes. However, these infections tend not to present themselves until the disease has progressed to an advanced state. It's because high blood sugar levels can weaken your immune system due to the buildup of plaque in blood vessels and the poor blood supply of infected areas. The ability of white blood cells to come to the place of infection and kill microorganisms is impaired. This makes it difficult for your body to fight off infections effectively. Excess blood and urine sugar create a perfect environment for yeast, making many women prone to frequent vaginal and bladder infections. However, getting blood sugar in check can help reduce the likelihood of getting yeast infections. 3. Nerve damage, diabetic neuropathy. Some people with type 2 diabetes will suffer nerve damage, and the condition is formerly known as diabetic neuropathy. According to Mayo Clinic, it's a common symptom that can impact up to 50% of people with diabetes. While there are different types of diabetic neuropathy, most people will feel tingling, pain, or numbness in the hands and feet, but it can also occur in other parts of the body such as the stomach, bowels, bladder, genitals, or even the heart. 4. Erectile dysfunction. In men, type 2 diabetes may cause problems getting or maintaining an erection, also known as erectile dysfunction. While these two conditions may seem unrelated, they tend to go hand in hand, as those who have diabetes are 3 times more likely to develop impotence. So what's the connection? Elevated blood sugar levels can cause damage to the circulatory and nervous systems. These two factors strongly hinder a man's ability to reach an erection firm enough to have sexual intercourse. 5. Irritated gums. People living with type 2 diabetes often notice that their gums become red, swollen, or irritated. They might also literally see how their gums are receding and their teeth stripped, experiencing gum infections, eventually resulting in gum disease. According to researchers at Marquette University, diabetes and gum disease can feed off one another, causing more severe forms of each disorder to develop. This means that diabetes contributes to gum disease, but vice versa is also true. 6. Darker skin areas that feel like velvet. A dark patch or band of velvety skin typically found in the folds of the neck, groin, or underarm area, or elsewhere could mean that you have too much insulin in your blood. This is one of the early signs of prediabetes that warns something is wrong. Fortunately, management of diabetes means that most skin conditions can be prevented and cleared up once caught early. Do you suffer from high blood sugar or diabetes? What are some ways you identify that your blood sugar is too high? What are the things you practice ensuring that your health is in a good state? Let us know in the comment section below. Thanks for watching. If you thought this video offered some useful information, give it a like and share it with your friends. It allows us to create more great content. If you want to see more videos from us, hit the subscribe button and turn on notifications so you never miss a video.